never heard the term medicalization before this discussion. On this NSP short, Dr. John Whelan not only explains the term, but outlines how it relates to post-traumatic stress disorder.
When PTSD post-traumatic stress disorder really hit Canada, it was on the books, of course, out of the Vietnam experience in the States. In around 2001, we had psychiatrists, academics come from the States teaching us about what was wrong with people's brains with PTSD, that they had altered brains. So out of that came this whole idea that PTSD is really like a brain injury, that there are different brain areas that are damaged. There are different processes in the brain that are damaged. And so it meets a specific set of criteria with cutoffs. You either meet like hyperarousal or or mood disorders and things like that meet certain criteria, and we can fit it in a medical diagnosis. And a medical diagnosis says we have prescripted treatments for it, medications, individual talk therapies. They become the solution to this medical disorder. Problem with the PTSD construct, if you will, I use that word construct, is that no brain area has ever been identified as a cause for PTSD. But the medical narrative that it is a medical condition that needs to be managed in private, and the best you can do is manage symptoms persists. And it's a pretty ingrained phenomena at this point. The problem with that, of course, is that when we look at the other aspect, which is the moral injury part, moral injury is being seen as more of that's just a perception problem. That's just because you're really not strong enough or have enough emotional fortitude. It's more of a separate issue. It's not really a medical issue, and I'm not arguing that either of them should be medicalized. But it places the moral injury and the influence of betrayals, bullying, harassment on a lower priority in terms of contributing to or causing the problem. Because most of the people I've seen with PTSD, diagnosed with PTSD, almost without exception, Chris, there is a strong moral component to it. I've seen very few where it's a discrete kind of something happened, I was overwhelmed, I got afraid, and I don't know what to do with the fear. That those cases are so minute, the percentages are so small that it's in my world at least, it doesn't even register. So medicalizing means really just putting it in a medical category. Medical people are the only ones who can diagnose it and treat it in a prescripted kind of way, even though we still have not identified causation. And that is fundamental to medical diagnosis.